Good morning, everyone. We're from SGDB7, the fourth semester of PSSK 2021. Today, we will present our student project presentation, which title is cholangiocarcinoma. Next. These are our members. Next.
Hey, good morning, everyone. My name is Putu Krishna Arsawardani Putri with last digit number 027, and I would like to present our background for our student project. Next. So, cholangiocarcinoma, or CCA, is an adenocarcinoma of the hepatobiliary system. It can be divided into three subtypes based on location: intrahepatic, perihilar, and distal. CCA develops from the malignant growth of the bile duct epithelial lining and is distributed throughout the biliary system. CCA accounts for 10 to 15 of hepatobiliary malignancies and are the second most frequent primary liver tumors. It accounts for about 3% of gastrointestinal malignancies. Several risk factors, including primary hepatobiliary illnesses, genetic disorders, chemical exposure, and infection have been discovered, even though many cases of cholangiocarcinoma develop spontaneously without a specific risk factor. Additionally, people with metabolic syndrome, obesity, and diabetes mellitus are also at higher risk. The diagnosis and treatment of cholangiocarcinoma is difficult and complex. Even with current available methods of dealing with CCA, it is still a seriously fatal condition.
Good morning, doctor. My name is Joseph Nga Xhi Wei with the NIM 250. So today I'll be describing the problem formulations and also the objective of cholangiocarcinoma. First of all, what is the definition? Epidemiology, etiology, and risk factors, signs and symptoms, pathogenesis, classification and diagnosis, treatment plan and management, complications, and also the prognosis of cholangiocarcinoma. And the objective are to understand the definition of cholangiocarcinoma, to understand the epidemiology, understanding the risk factors and etiology, into signs and symptoms, and also the pathogenesis, classification and diagnosis, and to also understand the treatment plan and management, complications, and also the prognosis of cholangiocarcinoma. That's all from me. Thank you.
Okay, good morning, everyone. My name is Ledwin Wibisono with the last three digits of student numbers 061. Today, I will present the benefits of our student project. Next slide. So these are the benefits of our student projects. There are three main benefits, and the first one is for the writers. The first one for the writers is this student project can be used for adding sources of knowledge for the writers and can be used to conduct research materials and for reference for the writers. And for the institution, it can be used to add sources of learning materials and especially about cholangiocarcinoma. It can be used for reference for conducting research also. And lastly, for the public community, it can be used to introduce to the public about what cholangiocarcinoma is and to increase public awareness about cholangiocarcinoma and as a guide to know more about the general knowledge about the cholangiocarcinoma. That's all from me. Thank you.
Good morning, my name is Gregorius Thongiratama with the last digit of student number 085. Now I'm going to explain about the definition of cholangiocarcinoma. Cholangiocarcinoma, or known as CCA, are malignancies that originate from the biliary epithelium and develop anywhere throughout biliary system. CCA could progress as malignancies in molecular level. They develop flowing long-term biliary damage, inflammation, and cholestasis. The molecular level of CCA development including some process, such as DNA methylation, histone distillation, and microRNA dysregulation. Currently, this cancer is contributing in 15% of all primary liver tumors, but there are no definitive data in statistics about the frequency of CCA in Indonesia. Furthermore, most of the patients are already in advanced stage while advancing to healthcare. Those patients have reduced chance of survival, especially if the patients have sepsis or history of biliary drainage trauma. That's all from me, and thank you.
Thank you for the opportunity. My name is Jennifer. The last three digits of my student number is 101. I will continue the epidemiology of cholangiocarcinoma. Next, cholangiocarcinoma belongs to a group of aggressive neoplasm emerging from any point of the biliary tree. This rare group of cancers account for 3 until 5% of all gastrointestinal cancers. Anatomically, cholangiocarcinoma is divided into three groups, which are intrahepatic, perihilar, and distal cholangiocarcinoma. Perihilar cholangiocarcinoma is the most common and accounts for 50 until 60% of all cholangiocarcinomas. Distal account for 20 until 30, and intrahepatic accounts for 10 until 20%. With this incidence, cholangiocarcinoma has become the second most prevalent primary hepatic cancer after hepatocellular carcinoma. These cancers also have different epidemiologies throughout the world because of differences in local risk factors and potential genetic predisposition. The incidence of cholangiocarcinoma also seems to be higher in some countries that are endemic to liver flukes, and this liver fluke is also the main cause of cholangiocarcinoma in Southeast Asia. In Indonesia, currently epidemiology data doesn't exist and little is known about cholangiocarcinoma. Thank you.
Okay, let me introduce myself. My name is Wijaya, with the last three digits of student ID number 227. And I would like to explain about the etiology and risk factors of CCA. Next. Okay, so the etiology and risk factors for CCA are quite complex and not fully understood yet. So I would explain it into two different parts, the fully established one and the suspected one, which would require more extensive research and evidence. So for the established risk factors are as the following: primary sclerosing cholangitis or PSC, then liver fluke infection or other hepatobiliary parasites, then hepatolithiasis, choedocalcis, especially type 1 and 4, Carollis disease, and chlorotrus. Meanwhile, the suspected risk factors are as the following: cirrhosis, hepatitis B and C virus, diabetes mellitus, obesity, chronic alcohol use, especially more than 80 grams per day, tobacco exposure, biliary enteric drainage procedure, and exposure to chemicals such as dioxin, nitrosamine, polyphenol, and polyphenol chloride. Also, inflammatory bowel disease and non-alcoholic fatty liver disease. Okay, so from all I have said before, I would like to note that the prevalence of CCA is the highest in Asian countries, most likely because of the culture of eating raw fish meals, which can potentially lead to liver fluke infection. Meanwhile, those from the western side of the world develop CCA without any specific risk factors, and thus far, primary sclerosing cholangitis with or without inflammatory bowel disease has been established as one of the most notable associations of CCA in Western population.
That's all from me. Thank you.
Okay, I will continue the presentations. My name is Felix Djuanda with the last digit of the student number 11 seconds. I will explain about the signs and symptoms of CCA. The early stage of CCA is usually asymptomatic, but the most common symptoms that's shown in CCA is jaundice. But in the intrahepatic CCA, the jaundice is less frequent, but usually followed with asthenia, malaise, nausea, and weight loss. Also anorexia. The other signs we can find in the CCA is dark urine, clay-colored stool, and pruritus.
Okay, thank you. My name is Dr. Nathalie with last three digits of my student number is 135. And in this opportunity, I will explain about pathogenesis of this disease. Next. Okay, so the etiology and risk factor of this disease are quite diverse. And for in general, the pathogenesis of this disease begins with chronic inflammation of the biliary system or cholestasis. This results in increasing inflammatory mediators such as interleukin-6, TNF-alpha, COX-2, and WNT. And then the mutation in tumor suppressor gains, proto-oncogenes, and DNA mismatch repair gains can occur, which can eventually lead to malignancy. in this case is cholangiocarcinoma. Maybe that's all from me. I give it to my friend. Thank you.
Hello, my name is Marta and my last digit of student number is 064. Now I'll talk about the classification and diagnosis. So cholangiocarcinoma can be classified into two types based on its location. Next please. First, intrahepatic cholangiocarcinoma or ICC. This is a type of cancer that originates in the bile ducts inside the liver. The most common subtypes of ICC are mass-forming, periductal infiltrating, and intraductal growth. Second, extrahepatic cholangiocarcinoma or ECC. This is a type of cancer that starts in the bile ducts outside the liver. The most common types of ECC are perihilar cholangiocarcinoma and distal cholangiocarcinoma. The diagnosis of cholangiocarcinoma is made through a combination of imaging tests and biopsy. First, imaging tests such as CT scan, MRI, and ultrasound. These tests can help identify the location and size of the tumor. However, imaging tests alone cannot confirm the diagnosis of cholangiocarcinoma. Second is biopsy is usually used to confirm the diagnosis of cholangiocarcinoma, and the last is blood test can also be useful. Elevated levels of certain liver enzymes can indicate liver or biliary tract disease. Additionally, elevated levels of a protein called CA19-9 in blood may suggest the presence of biliary tract cancer, including cholangiocarcinoma. That's all from me. Thank you.
My name is Ariela Rahardjo with last digit NIM 247. Now I will explain about the management of cholangiocarcinoma. The management of CCA or cholangiocarcinoma depends largely on anatomic location to dictate if a tumor can be resected and stage of disease. Resection remains the best curative option for all types of CCA, but it is only possible in about 35% because symptoms accumulate so diagnosed at late stage, the tumor progresses rapidly and CCA is difficult to diagnose. There are three types of CCA, include iCCA, PCCA, and DCCA. Liver resection is the only widely accepted curative treatment for iCCA. However, because iCCA presents in advanced stage, only approximately 15% of patients with iCCA are candidates for liver resection. Other than that, chemotherapy and immunotherapy also can be an alternative choice. Although both liver transplantation and surgical resection for PCCA can offer cure, resection has historically been the preferred option. However, since most patients are not candidates for curative surgical resection, endoscopic retrograde cholangiopancreatography or ERCP provides a minimally invasive, cost-effective, and lower risk for leakage, also safe intervention. DCCA and PCCA are similar, but they have different anatomic location. As with other types of CCA, the treatment of choice for DCCA is surgical resection. However, patients with DCCA are typically treated with pancreaticoduodenectomy rather than liver resection. When disease is unresectable, only palliative treatment is possible for most patients, about 70%. I guess that's all from me. Thank you.
Hello, it's Prastiti with last three digit number 028, and I would like to describe about complication of cholangiocarcinoma. As my friend has said, radiotherapy is one of the therapy management in cholangiocarcinoma. It can cause some complications like heart to the gastrointestinal mucosa, prolonged liver failure, biliary strictures, and portal venous and hepatic artery problems because endothelial cells from the portal structures are radiosensitive. Other treatment like surgery can also cause some complications such as biliary fistulas, infection, bile duct leaks, and intra-abdominal abscesses. And in cholangiocarcinoma treatment by neoadjuvant radiation, venous thromboembolism is also frequently discovered. I think that's all from me. Thank you.
My name is Ayu Karralika Raidinjana with the last digit number 246, and now I'll explain about the prognosis of cholangiocarcinoma. So the prognosis of cholangiocarcinoma tends to be poor with the median survival of 24 months, especially in case of lacking early attention and limited treatment options. There are some factors affecting survival, which are membrane status, lymph node metastasis, vascular invasiveness, residual liver function, tumor number, single versus multiple, and vascular invasiveness. That is all from me. Thank you.
Hello everyone, my name is Natania Sutedja with the 3 last digit of student number 175X. Here I'm going to explain about the summary of the cholangiocarcinoma. So cholangiocarcinoma are malignancies originating from the biliary epithelium, and cholangiocarcinoma belongs to a group of aggressive neoplasm emerging from any point of biliary tree. There are some risk factors, and the risk factors are primary sclerosing cholangitis, liver fluke infection or hepatobiliary, parasites, hepatolithiasis, Caroli disease, choledocalcisis, and thoratrus. And there are the early stage of cholangiocarcinoma is usually asymptomatic, and there are some signs of symptoms including jaundice, asthenia, malaise, nausea, weight loss, and anorexia. And then cholangiocarcinoma can be classified into two: intrahepatic cholangiocarcinoma and extrahepatic cholangiocarcinoma. All etiologies and risk factors will lead to chronic inflammation or cholestasis. This can cause inflammatory mediators to increase cholangiocytes. This can result in mutation in tumor suppressor genes, proteogenes, and DNA mismatch repair genes. And how to diagnose cholangiocarcinoma is by imaging test, biopsy, and blood test. Next. So the management of cholangiocarcinoma is basically by resection, but usually only 35% of the can be resected after surgery, including biliary fistulas, infection, bile duct leaks, and an intra-abdominal abscess. And there are factors affecting survival of the patients, including margin status, lymph nodes, metastasis, vascular invasiveness, residual liver function, tumor number, and vascular invasiveness. That's all from me. Thank you very much.
Okay, my name is Kusuma Mulya with the last 3 digits number is 1 and 51. Next slide, please. Okay, so here I would like to present the recommendation from cholangiocarcinoma. Since this disease can be manifested to be more severe disease, further research and acknowledgement for advanced therapy for this type of cancer should be done. Preventive actions need to be massively promoted by letting the public aware of its early symptoms and the urge to go to the healthcare. Next slide, please. Okay, thank you. That's all from our presentation today about cholangiocarcinoma. Thank you so much for your attention.